Imagine waking up one day and being unable to recognize your spouse's face, or looking at a book just to realize you cannot see well enough to read your favorite novel. This is the reality of living the life with macular degeneration and how it affects millions of people across the world. But what really is macular degeneration? Today I want to take a closer look at the definition, causes, symptoms, and treatment of this disease. Many people are familiar with the name of the disease but do not know much about it. Similarly, most people do not know the signs and symptoms to detect the disease in themselves if it is needed. I want to bring awareness to the disease to prevent late detection and protect people's vision. Cleveland Clinic defines macular degeneration as an eye disease that affects the central vision and is most commonly caused by aging. In order to understand macular degeneration, we should first lay a foundation of what anatomy of the eye that it affects, which is the macula. The macula can be found towards the posterior portion of the eye. It is located specifically in the center of the retina and is responsible for offering us detailed and precise visual acuity. Health Day News states that age-related macular degeneration involves progressive damage to the retina, which leads to worsening vision. The breakdown of the macula is where we see macular degeneration come into play. This disease is categorized in two different types, wet or dry degeneration. Dry macular degeneration is the more common and less severe of the two. Eye Center of Texas states that 80 to 90% of patients with macular degeneration have dry or atrophic degeneration. Dry degeneration symptoms include minimal vision loss, and the macula shows only small portions of drusen, which are yellow protein deposits. Whereas with wet or exudative degeneration, the macula exhibits newly formed blood vessels. These can be found underneath the retina, and this is called choroidal neovascularization. Wet macular degeneration is identifiable by the significant blurry vision that is caused by the leakage of fluid from those new vessels and the central vision loss that can occur more quickly due to the severity of this type. With the background and symptoms now established, it is important to know what treatment is available. Justice P. Ehlers writes about the management of dry and wet macular degeneration in his book called The Retina Illustrated. He lists the most effective treatment for dry or atrophic degeneration, including multivitamin or mineral supplements, and to be monitored every 6 to 12 months by your optometrist. Depending on the patient, some will be referred to see a retinal specialist for dry AMD as well as seeing their primary optometrist as well. As for wet or exudative degeneration, Ehlers lists antivascular endothelial growth factor therapy as an improved form of management. This therapy serves to preserve remaining visual acuity as well as offering the potential for improvement in visual acuity. The injections and treatment are still a challenge due to the severity of this characterization of the disease, but the author clearly depicts that these symptoms can be and have proved to be effective. We have gone over how this disease affects the macula, the difference between wet and dry degeneration, the symptoms to look out for, and the most effective treatment plans. My hope is that one day research will find even more effective care for patients with this disease. Although macular degeneration affects millions of people's vision on a daily basis, I hope this was effective in spreading awareness to protect your own vision. Thank you.
I like that you kept your